Hello friends, let's talk about antagonism. So for explaining this, I'll take the example of acetylcholine and atropine. Now acetylcholine, if we give acetylcholine, we can see its effect on the heart. It decreases the heart rate. Okay. And in case of the vessels, it decreases the blood pressure. Okay, so this is one effect which is seen with acetylcholine. Now, atropine is a blocker of acetylcholine on the muscarinic receptors. So, uh, being a blocker, you would expect that the opposite effects will be seen. Okay, but the actual effect which we see on the heart, what we see is okay, it increases the heart rate. This is the clinically the effect which you see. But on the vessels, if we give atropine, there is no effect. Now, why no effect? Atropine is same, acetylcholine is same. If it is causing a change in the heart rate opposite to acetylcholine, why not here? So that defines antagonist for you. And for that, you need to understand what antagonist actually is. So antagonist, we define that it has got two things. One is it has got affinity and intrinsic activity. So affinity in case of agonist or antagonist, everyone, it is one. One means it will bind to the receptor, and intrinsic activity is what it does after binding. So in case of agonist, the intrinsic activity is 1, but in case of antagonist, the intrinsic activity is 0, which is the case with atropine. Now owing to this, what happens is, means it will bind to the receptor and will not do anything. So how does an antagonist act? What it will do, it will oppose the effects of acetylcholine in this case. Okay, so it will oppose the effects. So it will oppose the effects of acetylcholine on the heart, that is fine. But why is not opposing the effects of acetylcholine on the vessels? There is no effect on the blood pressure. Okay, so the reason for that is because normally in the heart, acetylcholine is normally present as a form of the vagal innervation. But in the vessels, there is no acetylcholine because there is no parasympathetic innervation to the vessels. Okay, so whenever we see an increase in the heart rate, it is not due to any effect of atropine, it is due to blockade of the effects of acetylcholine. All right, but in case of the vessels, because there is no acetylcholine present in the vessels, so atropine goes, it binds to the receptors, but since there was no acetylcholine to begin with, you will not see any effect because by nature, the antagonist does not do anything at the level of the receptor, right? So it will just block the effect of acetylcholine. So if acetylcholine is present, you will see an opposite effect with atropine. If acetylcholine is not present at that site, you will see no effect. So that very nicely defines uh, antagonist for you. I hope you like this video. Thank you.